The way it works is in 2004, the government of the day negotiated a health accord so that they could play catch up because funding was really lagging. And so they agreed to pay 6% per year till to 2014. In 2014, it stopped, and the government now changed the funding formula. And that funding formula now means that because of the aging demographic in British Columbia, that's going to put a lot of extra pressure on British Columbia. In 2017, now the government says that they are going to tie it directly to the rate of growth. The provincial government says, well, we're going to lose out on $5 billion over the next 10 years, and in fact, this is going to put tremendous strain on the healthcare system. When you look at 1980, when the federal government funded it to a certain level, it was around 38 cents to the dollar, and now it's about half of that. So basically, the point is, it's going to matter to a lot of you here tonight. We're going to have a lot of eroding healthcare unless we do something. The Liberal government says we will fund it right back up to the proper levels.
The NDP will restore the funding. So, our health services are getting more and more depleted all the time. Our services our needs are growing within our community, but the availability is dropping as well. So we need to restore those fundings. We need to work with our provinces and to have adequate health services for everyone. And I did talk about earlier in the fact that having 7,000 more doctors and nurses and practitioners coming in. And universal pharmacare, we want to have universal pharmacare in place.
There's been 6% increase per year since we formed government in 2006. It started at $26 billion. Up to 2017, it's going to be up to $40 billion. That's in no way a cut in any shape or form. And I just wanted to clarify with Mr. Shaw, wasn't it your Liberal government that slashed healthcare transfers a number of years ago? I think it was. We've realized it's a priority for us. We always have realized it's a priority for us. Healthcare spending is going to be continued, and we're supportive of that. The doctor shortage issue, again, I've already been working on. I think some of the issue lies with local College of Physicians issues too, and allowing a bigger intake of local doctors, especially British Columbian doctors. And there's other issues there I think that we can fix to bring up that number that hasn't been addressed adequately yet. But that's a work in progress and still needs to be worked on. But as for funding cuts, it's not true.
Immigrant doctors, nurses, all these people, and when they get to Canada, they're skilled. We should be putting them, educating them up to our standards and putting them in the field to work. We're short up here. I'm sure we could, they'd be happy to work in the medical field in the North. The North has always been a hard place to get medical help when we need it. We have shortages. When it comes to funding, that's a non-issue. If we need doctors and we need to increase the budgets, then we got to increase the budgets. This is infrastructure, and it's a needed infrastructure, because if it's a lot cheaper to have a single desk healthcare system with pharmacare and dental services all covered than having it all being borne by the individuals and employers. This is another employer's expense that they don't really need or want. So we have the system right now, and it's decaying, and we need to fund it properly. The cuts in the funding right now is getting very desperate. BC, I think, is the only province that has a pharmacare program, and it should be national. This should be a federally looked into matter.